We are gathered here together. All right, so we had some questions. Thank you, Irma, for asking. What do we do in vision therapy? What is it all about? Because you guys are answering the phones, you get questions, patients are back in vision therapy, and then the parents start to ask you questions. And it would be really helpful to have a little understanding of what the process is and what we're doing. Some of you may know this already just by observing and seeing the patients come and go, but I'm going to start with the exam sequence. Actually, we start even way before that. We start on the phone. So when people make appointments, you can obviously tell who is looking for a vision therapy evaluation and who's just looking for a routine eye exam. The ones that are looking for the vision therapy evaluation, especially the new ones, are asking for me by name, or they're asking for a doctor that was referred, they were referred by some other professional. So they tend to talk to you a bit. They're going to tell you about their kid. They're telling you about what problems they're having. And that's important to jot down if you can when they do. So it's good to get all that information. You want to get information about, what other doctors they've seen. You can ask about what types of problems they're having in school. Most of them have concerns, and it could also be the traumatic brain injury to patients, they've had a stroke. So asking those kind of questions, and maybe even keeping notes or putting it into the notes section when you're making an appointment is really helpful, because part of their problem is that people haven't found or identified problems, and they're frustrated. They are at their wit's end, or they've been to multiple doctors and they haven't figured out what's the problem, and they really just want to be heard. And the more information you take on the phone, they're going to feel like, oh, this is the right place to come. Because vision therapy is very costly in terms of time and finances, and they want to make sure that they're making the right decision and they're coming to the right place. So in order to do that, you want to make sure that they feel comfortable even from that phone call. So again, that's why we're doing this. The more that you know about vision therapy, the better, because then you can actually answer some of their questions or help them, and then they feel much more comfortable giving up their time and their money for months and months at a time, thousands of dollars, because they know that we know what we're doing. So once they make the appointment and they come in, they see that we do something a little different than regular eye exams. We're asking to draw something. We're asking a lot of questions. We ask about all sorts of symptoms and problems, like do you see double, or do you have blurred vision, whatever else on that history form. But we're also looking at, are they sleeping, are they eating healthy? For the kids, we're looking at, did they start in kindergarten on time, or did they were they held back? Are they working to their potential in school? If they've had a stroke, what kinds of problems are they experiencing? What other therapies they're getting? So that's looking at the whole person. Then when we go into the exam, we do a lot more tests. We have what we call a primary care exam, which is typically what Dr. Carr, Dr. B, and Dr. Rodriguez do. I will do that, but most of my patients are not the primary care exams. I do primary care plus what we call the sensory motor exam. Sensory motor exam is a lot more additional testing, so I might do 5 tests that tell about focusing, 5 or 6 tests that tell me about eye teaming. Do those eyes work together? Then I'll do tests on eye movements. Can they track? Can they hold their fixation, stay looking in one place? Can they move their eyes from point to point quickly for reading, or can they move them slowly? Those are the 2 types of tracking eye movements. So we're looking at a lot of different things. I'm also looking at their health and wellness and their general health and wellness. I can tell learning styles and tell about how, what's the best way to teach them. So all of that I'll get in the exam, and then I'm going to be sharing that information with them. A lot of times they have no clue that they're going to get all of that in an eye exam. They think you're just checking their eyesight. So it's a lot to process, and that's why those patients will start to ask more questions later. That's why they want reports. That's why they might call back and say, well, what did Dr. Schulman say? And then The other thing is, in the primary care exams that the other doctors do, they might find enough of a problem and then they'll come back for a sensory motor eval. I just tend to see a lot of patients that might have seen other doctors and then are coming to me straight for the sensory motor. The last piece to an evaluation is the visual perceptual eval. So we'll also do a visual perceptual eval after the primary care and sensory motor evaluation, and that's looking at things like eye-hand coordination, visual memory, processing skills, right-left awareness, looking at maybe do they have some dyslexia problems, we'll do some reading tests. So there's a lot more other tests that we'll do, and that's a much bigger chunk of time. We always do that on another visit. So even when they call in, if they sound like a really complicated case, you could say, well, I'm going to book you for this appointment, but very often, the doctor will want to do another exam or might have you come back. So you can kind of start to say those things. I think that's helpful, so that they understand that, this is an involved process. Once we make a recommendation, whether it's prism glasses or vision therapy, but let's take when we do recommend vision therapy, the next step that we're implementing is actually to have the insurance checked to see where we're at, but we are moving away from insurance. We are moving towards out-of-pocket payments, and we'll be transitioning to mostly what we call a vision information processing therapy, which will not be covered by insurance. So that I just wanted you guys to be aware of. We're kind of moving in that direction, because vision therapy, as it's defined by insurance, is not necessarily really covered, and their definition is actually not necessarily what we do. Their definition is orthoptics, which is really trying to straighten the eyes for surgery, and that's not necessarily what we're doing. We're working on teaching them how to see, how to track, how to focus, how to use their two eyes as a team, and how to get all of that information that's coming in through their visual system, make sense of it, and be able to perform, be able to do well in school, to be able to read efficiently, to be able to write well, to be able to understand what they're reading, and then do well at sports or get back to their daily living skills if they've had a brain injury. So that's kind of what we're doing in vision therapy, but it takes a long time. We have to work with them on a regular basis. They need to show up weekly and then do their homework. So we ask them all to do homework 10-15 minutes a day, plus coming here. It's important to do the progress evaluations on a regular basis, every 10 to 12 visits, to make sure that we're moving in the right direction, make sure that they are making the progress that they should be. The interns, the therapists know how to program and plan ahead what needs to be done. And they'll get help from the certified therapists, which are Deb, Susan, and Anya, as well as the doctors. I'm always available to help them, plan what to work on, but there's certain things that we know to do for different cases. At that very first session, so we'll back up. I was saying that we're going to check on the insurance, then we'll also call them to kind of review what's been recommended, and if they haven't scheduled right away. We're also implementing, which I sent the email about last night, we're implementing a vision therapy workshop that we'll do probably in a different location or a couple of months in different, varying locations, so that parents can ask questions about it, understand what vision therapy is, and then understand the whole financial process and the time commitment and what we're asking. And also recognize what's the benefits of vision therapy, but also if they don't do vision therapy, what happens. And I think that's really important too. So they hear all this stuff in the exam, they know that we're looking at different things, but then they show up for their first session of vision therapy, and half the time they don't know why they're there. So most of the therapists always start with, do you know why you're here? And then reiterate based on the diagnoses and whatever notes I put in the EHR. They'll explain to them, no, Dr. Shulman or Dr. B or whatever found that you have a focusing problem, that your eyes don't work together well, or that you have a tracking problem, and we need to work on it in order to get you to be able to read better or whatever. They go over and set goals with the patient at that first session, so there's a list of goals that we're working on. Whether it's read faster, get my homework done quicker, reduce my prescription, do better at sports. But they literally go over the goals with them. They actually review their symptom checklist. So they have a symptom checklist. That first session says, all the different things like, loses place or has headaches, whatever it is, and they have to look at their symptoms so that now